Hi guys, we're gonna go through today how to reconstitute medications and how to prepare them, and then we'll go into the patient's room and we'll talk through pulling up Epic and how you are going to know the length that you will administer the medication over, as well as how to double check the patient and scan all the products when you take them in there. So I have here my diluent and I have my medication. I pulled them out of the Pyxis. They will come as kind of a package deal. So when you type the medication in, the diluent, if it is applicable, is going to pop up with it and you'll be able to move them both from the Pyxis. I also have my 10 ml syringe because my diluent is 10 mils for my medication. I have a needle to withdraw the diluent and inject into the medication with. And then I also have a blunt cannula just to place on the end of my syringe when I'm finished reconstituting to safely and sterilely carry the medication into the patient's room. So we are going to be having a sterile product preparation area that will be set up on every unit. This is what it's going to look like. It's a black tray and it has a special sign on it that tells you exactly what the area is made for. So prior to reconstituting your medication, you need to wipe the area down with your purple top wipes to make sure that it is clean and sanitized and we're ready to go. So you'll wipe down the area, having that wet contact time of 2 minutes. And then we of course need to let the area fully dry before we start reconstituting. I'm then going to change my gloves, and I would perform hand hygiene right now prior to donning new gloves and preparing to reconstitute my medication. So the first thing I'll do here is pop the tops off of both of the medication and the diluent. I'm then going to take 2 separate alcohol pads and I'm going to clean off the tops of both the diluent, scrubbing for 10 seconds, and also the medication with a separate alcohol pad. I'm going to leave those to dry and then I'll get my syringe ready. So I will take my sterile 10 ml syringe and I'm going to attach my needle to the end of that, of course keeping the end of the syringe sterile and the needle hub sterile. I will remove my safety cap, and then I have 10 mils of fluid here, so I'm going to draw up 10 mils of air, and I'm going to inject the 10 mils of air into my vial. And I'm going to invert it, and I'm going to withdraw the 10 mils of diluent into my syringe, making sure that I have exactly 10 mils. I'll then withdraw my needle, and I'm going to place the diluent into my medication. So I'll inject in, placing it down on a nice firm surface, filling up the vial. I'm then going to gently roll the medication. I'm not going to shake it, just gently rolling until it's all dissolved. Then I'm going to withdraw my medication out of the vial. Making sure I get all the medication out and I have my full 10 cc's in my syringe. I'll then remove my needle. I'm going to put the safety cap on, take it off, and then I'm going to put my blunt end cannula on there so that I can sterilely transport it and safely into the patient's room. I will then immediately label it here with my label. So the labels look like this, and you need to fill in all the information on there unless you are going to be carrying that medication into the patient's room without setting it down anywhere in the meantime. It's probably not likely, so I'm going to label it right now. I'm then ready to go into my patient's room. I'm going to take my medication and I'm going to take my 2 vials in there because I need to scan both of these vials into Epic prior to administering my medication.
Go.
All right, so we're in our patient's room now. This is Mr. Bob, and I'm just going to go through my steps of medication administration, and I'm going to identify my patient. I'm going to scan his armband and then scan both of the medication vials that I brought in here from our sterile tray where we reconstituted the medication. Hi, Mr. Bob, how are you doing today? Could you tell me your first and last name, please? He said it was Mr. Bob, and the MRN number matches my MRN number in Epic. I'm gonna scan Mr. Bob's wristband. He's now scanned into the system, and then I'm gonna come over here and I'm gonna scan my diluent, and then I'm also going to scan my medication. So I'm then going to come over and double check my administration instructions. So here it tells me to administer it slow IV push over 5 minutes, followed by a 10 cc normal saline flush. All right, so now I'm going to just let Mr. Bob know. Mr. Bob, I'm going to be giving your antibiotics right now. I'm just going to inject them into your IV line right here. We have to inject them over about 5 minutes, so I'm just going to make sure that I'm looking at my watch, and timing for those 5 minutes is going to be a little bit of a slow process. So if you feel like you're experiencing any side effects from that, you just let me know. So I'm scrubbing my hub here for at least 10 seconds. I'm going to flush my IV line really quickly here and make sure that I get a good flush and good blood withdrawal on the line. So it's flushing easily, and I'm getting a little bit of flashback. I'm then going to take my labeled antibiotic that I made and hook it up to my injection port here, and then my 5 minutes will start. I'm just going to very slowly push the medication while I'm making sure that I'm watching the time. All right, so I just finished pushing my antibiotic in, so I'm going to disconnect my syringe, and I'm going to scrub off my hub. I'm then going to take my normal saline flush, 10 mils, just like it said in Epic, connect it to the hub, and I'm going to give the IV a good flush. After that, I'll disconnect. I'm gonna lock my line off, and then I'll make sure that I clean one more time with a fresh alcohol pad. So that concludes the education on how to administer IV push medications. We are going to be moving over to that method of administration based off of a shortage of Minibag Plus that exists right now. I will post a few pictures at the end here of some resources that are available to you. Those resources will also be posted on the source, and you can always reach out to your unit director or educator for further information and guidance should you have any questions. Thank you for watching.